Reunited, surgeon Philip Davey and Dennis Moody from Coxo. The 81-year-old was back at University Hospital North Durham, where he was the first patient to be treated in the new £1.9 million hybrid endovascular operating theatre, which allows clinicians to treat patients with diseased veins and arteries using X-ray-based keyhole techniques.
Essentially, this is both an operating theatre and a fixed imaging centre, all co-located in one area, and that's very unusual. In most hospitals, you would have an imaging facility in X-ray, which is separate from the operating theatre, and then you would have a dedicated operating theatre suite. But what we've decided to do, and many trusts will be following, is to co-locate both the operating theatre and the interventional suite in one area.
The advantage of the new hybrid theatre, the first of its kind in the northeast, is that if the less invasive keyhole technique is not successful, surgeons are able to switch to open surgery in the same episode of care.
This is the star of the show, our new imaging facility, which allows us to treat patients, diagnose and treat on the same day. This is where the patient would come in and be laid on the bed. The bed can be moved in lots of different directions to facilitate the X-rays. Down at the bottom of the table we have our control panel. This control panel controls the imager, it controls the bed and it controls the viewing.
Vascular disease accounts for 40% of the deaths in the UK. Dennis was fitted with a stent and had his aneurysm fixed. He was in hospital for just 2 days.
Excellent when I come in. Before I had the operation and after, couldn't have been nicer. I've no complaint at all. Both the car, the nurses and the doctors, everybody worked there. I thought it was great. I feel fitter now than what I've done for years.
And that is your aorta, and you can just see the white rim, that's your stent. And you can actually see it on a different view here. This is your stent. It's quite special to bring a patient back into a place that he's actually had his treatment. That is very unusual. I mean, he admits he can't really remember much about being in this environment, and that stands to reason considering he was about to have a huge procedure. But I think he appreciates now exactly what the whole team was done for him and what facilities were required to address the pathology that he had.
The new theatre now means the Trust can provide a more efficient service, and patients no longer need to travel out of the area for complex vascular surgery.
The whole service has revolutionised in the last 3 years. We now have a coherent trust-wide service which is centralised to a vascular hub, which is in Durham. We work collaboratively up the whole A1 corridor, incorporating colleagues in Gateshead and in Darlington. Being able to deliver the service, the seamless service I want to deliver, it's very pleasing.